Hello, everyone, and welcome back for Season 2 of the Wellness on Purpose podcast. Here at the Wellness on Purpose podcast, we appreciate that there is no linear path along one's wellness journey and understand how easy it can be to get caught up in the latest health trends found on social media. Our intention is to provide you with impactful, educational, and realistic information to help you progress on your journey to live wellness on purpose now and for future generations. Hey guys, welcome back. Today we are joined by another amazing practitioner from Kawartha Care Wellness Center from Lindsay, Rebecca Foster. Rebecca Foster is a massage therapist that uses many different modalities such as hot stone massage, Indian head massage, and cupping to help support her patients. Rebecca's passion is to help each and every single one of her patients reach an optimal level of wellness to allow them to feel their absolute best. She feels the greatest as a massage therapist when each person leaves her treatment room feeling better than when they came in. In this episode, we talk about how these different modalities can support each and every one of her patients, as well as common problems that she sees in her practice, myths that come up as a massage therapist, and how she implements wellness in her everyday routine. If you're interested in learning more about massage therapy and how it can support your wellness journey, stay here and take notes. Okay, welcome, Rebecca. Thank you so much for being on the Wellness on Purpose podcast today.
You're welcome. Thank you, Marissa. Thank you for inviting me into this. This is awesome.
Yes, I'm so happy to have you. So let's jump right in. And how about you tell us a little bit about yourself, your wellness passion, who you are, and where you're from?
Oh my gosh, where do I start? Oh my gosh, this could go down so many different avenues. Okay, I'm married. I have been married for 36 years.
Wow.
Known my spouse for 43.
That's amazing.
We have 2 adult sons. And I have, through my adult life working, I've kind of always been in the healthcare field, so to speak. I started off as a homemaker. You know, it's been upgraded over the years to the different terms. Now it's PSW, so that's basically what I was doing. And I worked in pharmacy as a pharmacy assistant. I did that for 2 years. And then I kind of, did a few other things. I went back to school for nursing, because that was my lifelong dream, right? Ever since I was a kid, and I got that. But it turns out I was only in that for less than 4 years, like actually physically working, because the art of massage therapy drew me in.
Yeah.
And I got that because I would always massage people.
Mm-hmm.
And people kept telling me, you should be doing this rather than nursing. And I remember when I was a kid, my mom suffered from migraines. And I would always massage her back and her neck and her head, and her migraine would be gone. So then I didn't know what I was doing. I was probably a teenager or whatever. And, then other people, like I've got another friend who has fibromyalgia, and I would do the same thing with her, and it would be gone, right? And so I was working in nursing, and I said, you know what, I'm going to go back to school.
How old were you when you went back to school?
I was 38.
Okay.
So a long time, right?
Mm-hmm.
Both times I've gone back to school, I was already married and had so I kind of got a delayed start in that, and that's okay.
Yeah.
So anyway, so I did that, and I was 39 when I got my license, because my course I did through business school, and it was 19 months.
Okay.
So July of 2000 is when I became registered.
Okay.
And that's when my practice started, and now 20 years later, I'm still doing it.
That's amazing.
And I love it.
Good.
Yeah, so, like I said, it's just kind of always been my passion because, I'm pretty healthy. I do have some things going on with me because it's been work-related from my career, which a lot of RMTs do get chronic issues and that, but I do my best to look after myself by going for massage and chiropractic, because regularly is what my schedule allows and my life allows to. And I eat pretty healthy. And I walk. I don't get as much exercise when I know I need to. I mean, I believe in exercise and that. And I have done some workout routines years ago and things like that. And I drink a lot of water and things like that. And I try not to put a lot of junk in my body. I mean, nobody's perfect. I love the junk food as much as anyone else.
Yeah.
But it's no good for your body, right? And all that. But for me, I believe that I'm pretty healthy, physically and emotionally as well as mentally, and that's my goal, because I love being healthy.
Good.
And so my goal is, when I see my clients, is I want to see each person reach an optimal level of wellness.
Amazing.
To what is for them, right? I mean, I can't fix everybody, because it's a team approach, right?
Absolutely.
So that's my passion for wellness.
I love that. That's so
Thank
much.
you.
And I'm sure your clients see that as well. When you want to prioritize their health and wellness, I'm sure they all
and
recognize
because
that.
I love helping people, because I've always been in that, because like nursing is helping, homemaking is helping, even like all the babysitting I did as a kid, you're still helping. So it's kind of been throughout my whole life, right?
Yes.
It's just, I mean, people say, I can tell that you really love what you're doing because it comes through your hands.
Yes, yeah.
And I've been deemed the title Magic Hands.
Oh, that's amazing.
I don't know. I mean, like every therapist is different, so I appreciate that, and
Yeah.
that's okay.
That's
So,
amazing.
yeah.
Did you always know that you wanted to be in massage therapy?
No.
Or, okay.
No, because you know what? I never even knew about massage therapy when I was growing up. That was completely foreign to me, you know. And even when I was going through nursing, I had heard about massage therapy, but I didn't know where to go for it and like that. And I just never thought in a million years that I would become a massage therapist.
Yes.
I always thought nursing was going to be my long-standing career.
Yes.
Turns out you don't know, so you see, life throws you curves.
Yep.
And this was a good curve for me. Because
That's
if not, then I'd still be in nursing.
Yes. Yep. That's
No.
amazing.
Mm-hmm.
And then what other modalities do you use in your practice?
Well, I do cupping therapy, which is really good because it's easier on the body, but also too because of the technique of cupping, the way it draws the blood flow to the surface of the skin by drawing it up away from the body. It can aid in recovery sooner. I've had some positive results from it with the people. Such as low back pain or like a lot of restriction in the low back, and I did some cupping on that area of a gentleman, and he said it really, really helped, that his pain went down and he had no pain at all after a couple of days, and he's been good.
Wow.
Yeah.
So do you use cupping and massage in the same
I do,
treatment
yeah.
sometime? Okay.
I do, and it depends on what I'm treating. Like I will prepare the tissue first with some manual massage, and then I will apply the cups, and I'm still doing some manual massage in between and moving the cups around.
Fantastic.
And then-
So can you describe to our listeners exactly what cupping is or what that looks like? Like how do you perform that on somebody?
I started off with the glass cups,
Yes.
and you have like what I call a gun or a pump, right? It's got a handle on it, and I prepare the tissue first by doing a little bit of massage, and I'll take the cup and I'll place it on the area to be treated, and I'll apply the gun or the pump to the cup because there's a little rubber tip on it, and you just put it on and you just pull the trigger because the suction pulls the tissue up into the cup,
Okay.
thereby releasing the blood flow or the circulation. And then, of course, the skin becomes a little bit red, but you just monitor that throughout the process, the treatment with it, and you move the cups around so the area doesn't get too much because you don't want to damage the tissue, right? So you're always watching. And so, you know, we move around, and then after the treatment is done, then, of course, the marks can last up to a week, maybe sometimes 2 weeks, just depending on what was being done and how long the cups are in place. Because you can leave them in place for up to 15 minutes, but very rarely does that happen with me. I mean, I've had some people have the marks left for over a week and they were fine.
Mm-hmm.
They were quite all right with that.
Now, if they have a mark left for that long, does that indicate that maybe there's more problems
Yeah,
that are
there could
going
be
on?
some, like, maybe some long-standing adhesions in there, and so it just takes a little bit longer for that area to heal.
Okay.
And all that, but there's no long-term damage done to the skin. It's all good.
Yes, all good. That's
Mhm.
great. And what other modalities do you
Okay,
offer?
I do hot stone massage, and I am certified in that. The first time I did hot stone, I did a home study course, and that was when I was working elsewhere. That was really good. I'd never done that before, and I thought, okay, that was interesting to me, right? And it was kind of different, like massaging with stones rather than with your hands. So, you know, you're very clunky at first, right? Because you're making a lot of noise because you keep hitting the stones and they fall on the floor. Oh my gosh. But anyway, the hot stone massage is good for relaxation, for increasing the circulation. It helps with pain relief too, and it helps with those knots that you get in your body, like we call them trigger points and all that. But you guys, everybody else who doesn't know that word, it's knots, right? Or rocks, or whatever you want to call it, right? It's just a really tight spot in the body. And so the stones can help to release some of that tension in the muscle and decrease those knots, right, or the trigger points. And also, too, for pain relief, my takeaway from hot stone is I had a client who had had a car accident some years ago, and she had a chronic low back pain from that. So we've been treating her a few times, and I said, you know what, let's try the stones on them. So I didn't do hot stone for the whole body. I just had a couple, and I placed them on her lower back when she was laying on her back. But at the end of the treatment, she had no pain.
Amazing.
And that's where I said the benefits of hot stone can help aid in pain relief because of the direct heat that they're getting. And it's moist heat, right?
Right.
And it's not dry heat that you just get from sitting in the dry sauna.
Right.
Because this is moisture from the air, and then the water too creates that moistness. So that's my takeaway story from that.
That's great.
And I've had success even here when I've been into or even over the years. The same with the pain relief. I have one lady, when she tried the hot stone, it was beneficial for her back because she has chronic low back pain, and so every treatment she's booking it for hot stone massage.
Wow, great.
Mm-hmm.
That's good.
Yeah, and another modality that I do in massage therapy is Indian head massage.
Yes.
And I just love doing that one.
Are your clients just so relaxed while you're doing
They
that?
are. Yeah, they can read it. They're just about falling asleep.
Yes.
And I just did an Indian head massage the other day, and the lady, she was having a hard time talking because she was just so relaxed. So I love it because, again, it's easier on the body, and it's good for them because there's so many benefits to Indian head massage like most of the other ones, right? It's just a different way of doing it. And it increases the circulation. It helps with migraines and headaches. It promotes better sleep. Of course, with regular treatments of the same type of modality that you're getting, like not, say with anything that you do, one massage isn't going to fix everything unless, of course, you're coming in for a relaxation massage. So if you're stressed, that can help. But Indian head massage, hot stone cupping, some people it takes like a few treatments, sometimes it takes several, right?
Yeah.
And that's with anything you do, just like your car. Okay, when your car goes in for an oil change or maintenance, you have to keep that care up on your vehicle, right?
Yeah.
Well, your body's a vehicle too, right? We're using it every day.
Yeah.
So like I said, a lot of headaches and migraines and helping with sleep. And it helps with stress. And also it says it promotes hair growth.
Okay.
Because a lot of the techniques, because it's Indian head, is we're doing a lot of the work in the scalp.
Right. So do you use like an oil or something while you're doing this, or?
It's individual. My choice, because I've been using essential oils throughout massage right from the get-go. I leave it up to the client what scent they would like, because some of them are just good for the scent, for the aromatherapy purpose. But a lot of the essential oils, and I'm not an expert on essential oils, but I've used them a lot. They do have a lot of therapeutic benefits. Some of them can aid in pain relief, some aid in the circulation, releasing the headache and stuff like that. So like I use frankincense. It's called the Bible oil.
It is.
And it is actually from the Bible, like when Christ is born. Anyway, there's eucalyptus, which is good for sinus things and cold. So someone's got like a sinus problem, right? And if I was comfortable right now because of COVID, I'm not doing like full facials for Indian head because the face is part of it.
Yeah.
But for right now, I'll just do the areas that are not covered by the mask.
Right.
But apart from that, yeah, I would definitely be doing the sinus areas.
Amazing. So you might see that come more in the winter time with sinuses and colds.
Oh, definitely, yeah. Well, even like right now with the allergies, right? Because some people have a lot of hay fever, ragweed, and stuff like that going on. And it's really beneficial. Like I had a lady the other day. Was it eucalyptus, I think? And I was able to do just a little bit all the time, so just when the mask wasn't covering, and she had some relief.
Good. That's great. Yeah, essential oils are very powerful when they're used for the right modalities in the right
Exactly.
time, right?
They have to use properly, right?
Yeah.
You can't just apply the oil directly on the skin.
Yes.
Right, at least not all of them. Some you might be able to, but like, again, I'm not an expert. I always have to reread and things like that because I don't ever want to do anything that's not going to be good for the client.
Yeah, great. So, for massage therapy, would you say there's any type of myth that you see in this industry?
Oh gosh, don't get me started on that. Oh my gosh, when I read that was, oh my gosh, don't get me started. There's so many. Okay, first and foremost, okay, we are registered massage therapists. We did have to go to school and acquire certain many hours. We did have to write a provincial exam to get our certification or our license. Some places, maybe in the States, call it certification, I don't know. But anyway, we are registered with a governing body who watches over us, makes sure that we're doing everything legal and everything. And we're accountable to them as well as to the profession itself with other people. So we are registered. We're not just a handsy-pansy therapy, right? We're not just there for relaxation. There are benefits to it. And that's where a lot of people think massage therapy is no good because, they're not educated. They don't know that massage therapy can treat a variety of things. I've seen that in my practice. Maybe several years ago when I was here, this lady said, oh, she's massage therapy doesn't do any good. And then she had an issue. and she was seeing the chiropractor for something, so she got her to come and see me, and she was really hesitant, so we talked first. Got on the tree, and you know what? She was just, wow. I didn't know massage therapy could help that.
Wow.
So she was a believer in the massage therapy for the benefits of it, right? Because there's so many benefits to massage therapy. Like so many different conditions it can help.
Yes.
And all that. But two, there's also a lot of people out there think masseuse,
Yes.
it's the same as a massage therapist. It's not.
Yes.
A masseuse is someone who works in a body part, they do massage plus.
Yes.
So that's why I said, no, I'm not a masseuse, I'm a massage therapist. Some say, oh, I'm sorry. So I educate that
Yeah.
because I said people don't know. And I'm not offended when somebody calls me a masseuse because I recognize, okay, they don't know.
Yes.
So that's my role to educate them. A lot of us massage therapists say, we're not recognized as primary care providers. When it comes to car accidents or workplace insurance, we are not allowed to approve our own treatment plans. We have to have approved by a chiropractor, doctor, physiotherapist, or someone like that.
Right.
And that's a fight that's been ongoing for many years.
Mm-hmm.
And probably once I'm retired, it'll still be a fight.
Yes.
And so I don't know when we're ever going to achieve that status as primary care provider. So
Yes.
that's it in a nutshell. As I said, don't get me started.
Those are three big ones.
Yeah, they are really, really three big ones.
So, do you find that it's more accessible for caregiving when you're working with chiropractors or in a clinic sense rather than by yourself as a massage therapist for those modalities?
I think it just depends on yourself as an individual.
Okay.
When I started my career, I was mobile, 100% mobile. I wasn't used to working in a team setting with access to that because I didn't know, right?
Right.
So over the years, as I've worked in various clinic settings, and I really like that area because they are right there for you, and you can. And I know them now, well, because I've been doing this for so long. If I do have a question about something like that, then I can lean on the chiropractor or physiotherapist to help because I don't know all the answers, right?
Yeah.
And so especially if it's the same person that we're treating together, right?
Yes.
Then that way it's a multidisciplinary approach and we're a team here so we can work together like that.
That's amazing. That's great.
Great,
And that's just
thank you.
better care for your clients as well too.
It is, yeah, because sometimes they don't know what they want.
Yep.
Sometimes they'll come, and we've had cases here where someone will come, they don't know if they need massage, chiropractic, physiotherapist. And so sometimes we'll be asked, what do we think, right? Because we're not sure, and sometimes we'll talk with the person if time allows, or if that's what they need to do, and we can kind of guide them, and we can suggest one or the other.
That's great. That's a full team approach. That's
It
really
is,
good.
yeah, and I really like that. So
Yeah.
versus doing it on my own, yeah, a team approach is better.
Great. So, as a massage therapist, are you covered by benefits? Is that something that's accessible to clients as well?
OHIP does not cover massage therapy.
Okay.
Neither do people who are on ODSP or Ontario Works. Unfortunately, I wish they were because so many people need massage therapy and chiropractic and physiotherapy, but for massage therapists, and it's a real shame.
Yes.
I mean, I wish more people could access it
Mm-hmm.
because those without benefits do without.
Mm-hmm. Yes.
And that's really, really sad. For OHIP coverage, I don't know if that will ever come to pass because it hasn't been for years and I don't see it ever changing, but you never know, right?
Mhm.
And so it's people who do have extended health benefits through their work, it's really good for them because then they can use them, right?
Yes. That's great. Good. So you mentioned you live a very healthy lifestyle. You try to, be active, eat all the good things, take your supplements, and so on.
Yeah.
What would you say is one of your favorite products at Joanne's Place that you use on a regular basis?
I have to say, I love oil of oregano. Ever since I got started on that many, many, many years ago, when I had a coronavirus or something going on, I was going out for dinner with an older couple. And I said, I don't know if I can go because I'm all plugged up and I don't want to be around the people. I don't want to infect anyone with this. And you have to take oil of oregano. And of course, I'd heard of it, but I'd never had it. So they so graciously brought me up a few drops. And I took it. I was feeling almost 100% better the next day. And I'd already had this thing going on for a few days. So I'm hooked.
Good.
And I love it. And it's not just because it's another product on the shelf that claims to have health benefits. this really worked. And oregano, we know it's a spice, right, or a seasoning that you use in your cooking.
Yep.
And the oregano plant, right? And so, you know, I really, really do believe it, and that's my go-to, because I have a bottle now I've had for a year, and already, like I said, I've had an allergies thing going on with my sinuses, so I use oil oregano daily for this treatment.
That's great. And it is something that you can cycle on and off of, which is really great. So you can if you feel like something's coming on, or if you're around people that may have a cold, or you know the allergies are coming based on the season as well, you can take a few drops as a preventative
Oh,
too.
definitely, yeah, because I usually do what I do. When I first started, somebody said, well, put 2 to 3 drops in some water juice, drink it, and then chase it down with more water juice after, because it is pretty strong. So, yeah, it was really strong. Oh, that's horrible. But you know what? Now I'm used to it, and sometimes I'll just put in the drop, and I don't even chase it down with anything, because I'm so accustomed to it. It's just like taking Buckley's. We grow Buckley's, and it's the same thing, right?
Yes.
It tastes horrible, but it works.
Yeah.
I mean, it really, really is a good product to take for helping fight off viruses.
Yes.
Or any infections. I mean, and like I said, what can I say more about oregano? It's just my go-to thing. And for food-wise, I try to eat gluten-free, because I do have some digestive issues, so gluten-free works for me, and I go in Joann's, I get that, plus I'm lactose intolerant, so I drink almond milk.
Mm-hmm.
And so if Joann's is closed, I can't get there, then I have to buy it elsewhere, but when Joann's is open, and when I get there, then that's when I go to the almond milk or the gluten-free products.
Great. Thank you. That's good.
Plus my essential oils too, right? I buy my essential oils. And I like the Now brand, because I like how they smell, and I like that they're natural. Plus, Joann's carries a lot of organic products,
Yes.
which I really appreciate, because you know that there's no chemicals used on them.
Yes. That's a huge thing. And I think people forget about how many different things they're exposed to in the sense of chemicals. Like, especially right now, I understand that the cleaning protocols have to be of standard. It's very important. But we're being exposed to so many disinfectants and so many chemicals and things for the time being. So trying to look at other areas in your life that you can get as clean or as organic as natural as possible.
Yeah, I agree. Yeah. I know. And it's unfortunate that we can't be completely chemical free.
Yes.
I really wish we could be, because, you know, our bodies are so toxic to, because the exposure to different things like that.
Of course.
So if I can help my body to not be in every area, like foods or whatever, then I'm more than happy to go that route.
Yeah, great. So with your journey through your health, your wellness, and your practice, would you say that there's a couple steps that we can give to our listeners to help them implement and live more of an optimal wellness routine starting today?
Say I was in an elevator for someone, and we were, like, say, going up like several flights together, and you know, like, and it's a complete stranger, right?
Yep.
And you don't always have a lot of conversation with someone, especially you don't know them. But if something came up and they happened to notice I was wearing, like, maybe a scrub shirt from here, from where I work, so, oh, you know, this conversation strikes. And then you just get along that journey. And so my thing is that, you know, if you're serious about changing your life, attitude is everything.
Yes.
And setting achievable goals and sticking with them, or write them down, and then speaking with a nutritionist or someone like that, such as yourself, right? And just seeking that out, and just finding out as much as you can about the different wellness products out there, and what is good for you. And even if you have to go to your doctor and say, look, I want to change my life, I want to live a healthier life, because I don't know where you've been at your journey unless you want to disclose that to me. I'm not an expert, but I say, you know, you just really set your mind on it and be positive about it, and know that getting well overnight is not an easy thing. I mean, it took us a long time to get to where we were. I mean, like I said, I know I've been healthy for a lot, but like I said, I've had times where I was overweight a little bit, and I had a lot of digestive issues, but I've taken the steps.
Yes.
And I'm doing my best to maintain them. So life is not perfect. We're going to have our fallbacks that you get back on, but let's see, you have to really, really be serious about what you want to do in your life.
Absolutely. And I love that you said that, you know, it's taken people a long time to get to the point where they realize they have to make a change. But if you account for all of those years or months or however long that might be till you got to that point, we can't expect that instant gratification
No,
right
we
away when we
can't.
make the changes. It's just not realistic.
No, it's not realistic. That's why I say you have to set achievable goals, ones that are realistic and easy to achieve. Even if it's one small step, say you maybe only drink 2 glasses of water in a day or even one. Well, what I suggest even my own clients is to get a water bottle.
Mm-hmm.
And if you work at a desk in front of a computer like most of us do,
Yes.
have that water bottle sitting right there. I mean, get a minute, just pop it open and have a drink.
Take a chug.
And even if you sip on it throughout the day, at least you've got it there.
Yes.
Because I know life is busy, right? We don't have a lot of time just be sitting there chugging water all day, right? Some of us do. I have a son who chugs jugs of water. I mean, he's always drinking water.
Yeah.
But anyway, and like that's just one small step. Just maybe go from 2 glasses up to maybe a bottle of water.
Yes.
And that can be achieved relatively easy.
Yeah.
And if you don't like the taste of water, add some fruit to orange slices or cherries or whatever, limes, lemon. I mean, I do that, not all the time, and I do that. And some people say, well, they say cold water isn't good for you because it slows the digestive system. Well, yes, I've heard that too, right? But as long as you're getting that water, because your body needs it for hydration, your muscles, your tissues, your joints, everything. You need it to hydrate yourself.
Absolutely.
And even your skin.
Yes. Everything. You need it for every function,
And also,
right?
too, if you can get an accountability person,
Yes.
maybe a partner to help you with that, because maybe they need something like that too, so you can do it together.
Yes.
Because motivation always works best when you can have it with someone else.
Absolutely. I love that. So recognize where you're at and see what type of extra support you need to get your wellness journey progressed. Lots of hydration.
Yes.
Have an accountability partner. And then what is maybe some type of stretch or movement that our listeners can do every day to help either with back or hips or something?
This is so easy. If you can get up in the morning and there's a stretch called the cat camel stretch.
Yep.
A lot of people heard it's a yoga stretch. I don't do yoga myself, but it's really effective. It's just going on your hands and knees or even in bed and getting up there and just like stretching your back out and going in the camel hop and hold it for a few seconds and then just drop your belly down and do that a couple times. Or even like just the same stretch when you don't do that, you just lean right down to your heels. So just hold that. And if you do have back issues, be very careful. Don't do it fast. Just kind of slow and progressive.
Yes.
And because I never want anyone doing any stretches with pain, or even if you're a computer worker.
Yes.
Just taking a few minutes and just stretching your arms above your head and just stretching your neck out. Like just putting your one hand on your head and just stretching it from side to side and holding for maybe 10 to 15 seconds. You can hold up to 30 seconds. Rolling your shoulders.
Yes.
And all that stretching. And then just really stretching your arms out so that the muscles in front can get stretched out as well. And yeah, just some very easy stretches like that.
Doesn't take long, and I love that you mentioned, first thing in the morning, you don't even have to get out of bed, and you can start doing those stretches to help
definitely.
relieve.
I do that.
Yeah.
And if I forget to do it when, before I sit up, then I will lean over the side of the bed.
Yeah.
And I'll stretch right down to my toes.
Yeah.
And be careful not to go too fast because I don't want to get dizzy.
Yes. That's great. That's amazing. Well, thank you so much for being on our podcast, Rebecca. All this information is going to be a wealth of knowledge to our listeners. And I will tag where you can find Rebecca, and you can connect with her to help to optimize your wellness journey.
Great. Well, thank you very much, Marissa. Thank you.
You're welcome. Thank you guys so much for tuning in. Please be sure to like, subscribe, comment, and share on social media that you're listening to the Wellness on Purpose podcast.